presentation is on animal experimentation. So animal experimentation, what is it? It is basically any experiment that's performed on a live animal for biological or medical purposes. The most commonly used animals for experimentation are mice and rats, as well as primates. Animal experimentation began around 2,000 years ago with the experiments of Aristotle, Erasistratus, and it later evolved with English physician William Harvey, who revolutionized cardiovascular medicine. Animal experimentation has also led to vaccines, insulin, and skin grafts. And the reason it has been so successful in the past is because humans and animals are very genetically similar. In fact, they only differ about 1 to 3% differently from the human genetic makeup. And because of these reasons, animal experimentation has been very reliable. It's been very successful in the past, and they're very close to humans, and that's why many people argue for its continued use. However, more recently, it's been faced with many concerns regarding its harm, efficacy, and cost that beg the question, is the use of animal experimentation still necessary for scientific research? I will argue that no, it's not. Because first, animal experimentation is harmful. It deprives animals of their natural environments by placing them in cages and subjugates them to torturous experiments such as invasive brain surgeries, toxic fume inhalation, immobilization, and sometimes even burning alive. It is also very ineffective. Animal experimentation is so harmful that it actually induces stress in an animal. And stress affects the animal's heart rate, blood pressure, and cortisol levels, all of which change how the animal will react to an experiment or procedure. And this leads to inaccurate findings. Additionally, like I said before, humans and animals are different, but only by a small percentage. But this percentage can actually lead to animals having drastically different bodies and behaviors than a human. For example, an animal cannot develop Parkinson's, HIV, or schizophrenia because of these differences. And this ineffectiveness, along with the stress factor, lead to a 92% failure rate in clinical trials for any drug that's tested on animals. So they don't usually work. And that 8% that actually pass through animal trials cause over 100,000 deaths so far. A case in point would be the release of the Vioxx drug. It was tested on African grey monkeys a few years prior to its 1999 release, and it was proved to be effective in animal studies. However, it had to be withdrawn from markets in 2004 because it actually induced the risk of cardiovascular disease in over 4 million Americans and caused over 60,000 deaths just from this one drug in 5 years. The other concern is that it's very expensive. With the expenses of laboratory equipment, animal housing and care, clinical trials, and drug analysis factors in, it requires $12 to $14.5 billion from the United States government annually. And it costs over 5 years of extensive research, which only adds to its already exorbitant costs. So animal experimentation, although it worked in the past, is currently limited by its harm, efficacy, and cost, which asks, should it be used for scientific research? I argue that it's not because of this. So what can be a solution? So my solution is alternatives. And alternatives are basically just, they perform the exact same experiments as animal experimentation, but just with non-living organisms. Well, they're living, but they're not like a whole body. For example, we have in vitro methods, which are basically placing cells within petri dishes and performing tests on them, like toxicology, which is basically studying the effect of toxic compounds on the cellular level. Example of this would be the MatTech company. They have developed 3D tissue models, which is basically in vitro modeling, but within 3D tissues. One example is the melanoma model. So basically what they do is that within human tissues, they apply malignant melanoma cells. And this basically is to test the various stages of diseases. They have also developed a psoriasis model, which does the same thing, but for psoriasis. There's also the method of microdosing, which is basically using human volunteers and giving them small doses of a drug. So it tests the effects on the cellular level rather than the whole body. So it's a very non-harmful way of performing human experimentation. There are also biochips, and biochips are basically like little chips that have human organs on them, and you can test the effects of pathophysiology, which is a human reaction to abnormal or drug-induced states. For example, the Harvard Weiss Institute has developed a chip called Organs on Chips, and it's composed of a translucent and flexible polymer that has organ-specific cells within it. And these cells can basically simulate human reaction to drug and disease. Similarly, the MIT Institute has composed one called Body on a Chip, and it's basically the same thing as the Harvard Weiss Institute. It's composed composed of a microfluidic surface and actually has 10 specific organ cells in them. Both of these together can basically mimic human reaction within a chip, so it's not harmful. There's also human simulation. An example of this would be the trauma man. He can replicate human breathing, bleeding, skin layers and tissues, as well as ribs and internal organs. So it's basically a human model within a plastic context. The benefits of this solution are that they solve all three implications or concerns over animal experimentation. First, as they're not alive, at least not as alive as an animal is, they're only cells, they don't hurt as much. They're not as stressful, and they also aren't harmful. They additionally are much more accurate. For skin allergy predictions, they have a near 90% accuracy rate, which is over 18% more accurate than animal experimentation. Have an 86 accuracy rate for skin irritation predictions, which is 26% more than animal experimentation, and a near 100% accuracy rate for prediction of human toxicology, which is over 40% more accurate than animal experimentation. Additionally, it also takes much less time. It only costs about 2 to 4 months of study. I mean, there is some variation. Sometimes it costs a little bit more, but it's never more than a year. And sometimes it's even less. Like the MacTech tissue modeling costs only 4 weeks of study for that. It's also much less expensive. As you can see in this chart here, it only costs 16 to 50% less than animal experimentation. So it could cut the cost in half. There is the limitation that alternatives are they're a newer method of research versus animal experimentation. Animal experimentation has been used for 2,000 years, so it's been reliable and well-researched. However, alternatives are a much newer method, so they may not be reliable. Also, since alternatives are not living beings in the same way that an animal is, some people believe that they may not be able to accurately predict a living being just because of that. But with the research we have now, and with what we know now with both methods, alternatives are obviously the better choice because they solve all three implications of animal research and they can advance science much further because of this.
Okay. How did you handle the differing perspectives in order to reach a conclusion?
Well, in this presentation, in my IWA, I kind of had the perspectives of animal experimentation is bad and this is why alternatives are good. But in this presentation, I had to talk about why animal experimentation is both bad and good to reach the conclusion that I need alternatives. So I kind of had to, are you asking what research I needed?
Well, just the question is, how did you handle the differing perspectives? Like looking at them to figure out what you thought was the best thing?
Well, I didn't research as much as into the benefits of animal experimentation as I would have liked because I didn't really know the format of it. But when I started researching more into it, I realized that alternatives are the better option because like I said before, they're 18%, 26%, and 40% more effective than animal experimentation, so they're obviously the better choice in that way. That's why I came to the conclusion of alternatives. They're also much less expensive. So.
Okay. What additional questions emerged from your research? Why are these questions important?
Like research questions?
Uh-huh.
Probably, I kind of read into something called anthropomorphism, which is basically the application of human characteristics onto non-human entities. So I kind of read about that and it said that's why people think animal experimentation is harmful because we're humans. We think that being poked and prodded at is harmful, but animals may not feel the same way. And so I felt like that was an important question for me to do a concession and refutation with because it sort of brought that whole other context into it. Maybe we're thinking about it the wrong way, Something like that.
Okay, very good.